Hello, my name is Charlene Kirby, and I'm presenting on self-breast examination and the importance of this exam to be done by women on a routine basis. Let's begin with some statistics. 40% of diagnosed breast cancer is detected by women who feel a lump, so establishing a regular breast self-exam is very important. Self-breast exams will allow you to become familiar with the contour, the feel of your own personal breast. This in addition to a clinical breast exam, which is performed by a practitioner at a doctor's visit, and this is usually done at least annually. And a mammogram if you are high risk, meaning you have a family history of breast cancer, or you are age 40 or above. Women age 40 to 54 are advised to have an annual mammogram. Women age 55 and older are advised to have a mammogram every 2 years, unless they are high risk. Premenopausal women are expected to do their self-breast examination closer to the end of their menstrual cycle. And postmenopausal women are advised to continue to do their self-breast examination on the same day of every month. There are 3 very common methods of self-breast examination. One is in the shower, and that's by using the pads of your finger, moving around your entire breast in a circular pattern or motion from the outside to the center, checking the entire breast and the armpit area. Check both breasts for lumps, any bumps or knots, and if you find anything, to speak to the healthcare provider immediately. The next method is to check your breast in front of a mirror. Do a visual inspection with your arms at your side. Raise your arms high over your head. Look for any changes in the contour, any swelling, any dimpling in the skin, changes in the nipple. Next, rest your palm on your hip and press firmly to flex your chest muscles. Left and right breast will not exactly match, but still check for dimpling, puckering, or any changes, particularly on one side. Next method is to do it laying down. Lay down. The breast tissue spreads out evenly along the chest walls. Place a pillow under the right shoulder and your right arm behind your head. Use your left hand to move the pads of your finger around the right breast gently in a small circular motion, covering the entire breast area and armpits. Use a light, medium, and firm pressure. Squeeze the nipple. Check for discharge and lumps. Repeat these steps to the left breast. I prefer to do a combination of 2 of these methods because I am a visual person. I would advise to look in the mirror and to do a visual examination, and just to see if you notice any changes in your breasts. Then I also would encourage to lie down and relax and to do the breast exam lying down, and just palpitate your breasts in a circular motion gently, and if you noticed anything that looked abnormal, maybe apply a little slight pressure just to see if there's anything there of concern. Anytime there's an abnormality noted in your breast, it should be reported immediately. Some of the signs and symptoms of concern would be breast nipple tenderness, a lump or thickening in or near the breast or under the arm, a change in skin texture, or an enlargement of pores in the skin on the breast. Any lumps in the breast should be reported to a healthcare professional. That does not necessarily mean that you have breast cancer, but it is something to be investigated. To reduce your risk of developing breast cancer, there are a few things that are advised. 1. Maintain a healthy weight. 2. Stay physically active. 3. Eat fruits and vegetables. 4. Do not smoke. 5. Eliminate the alcohol consumption. These are generally good practices for good health, but also it will also ward off the chances of you developing breast cancer. Early detection, the greatest possibility for successful treatment. When breast cancer is detected early, it is in the local stage. The 5-year relative survival rate is 100%. So therefore, early detection is the key. And self breast examinations on a routine basis will assist in detecting any issues as early as possible. Thank you. This is the conclusion of my presentation. I hope that you did learn something and also enjoy the presentation. Be blessed.